This is the global threat of dengue fever, a growing global threat illustration offered by Epi-Eye.com.
Dengue fever, a mosquito-borne viral infection, is now one of the fastest spreading diseases in the world. Every year, around 400 million people are infected, and nearly half of the global population is at risk. From Asia to Latin America, and increasingly in Europe, dengue outbreaks are occurring more frequently and in new areas, fueled by urbanization, travel, and climate change. Dengue is no longer a tropical disease. It's becoming a global public health challenge.
The dengue virus and its vector.
Dengue fever is caused by the dengue virus, a flavivirus transmitted mainly through the bite of an infected Aedes mosquito, primarily Aedes aegypti and Aedes albopictus. These mosquitoes are daytime biters, thriving in urban environments, breeding in small water containers, and capable of spreading 4 distinct virus serotypes, DENV1, 2, 3, and 4. Infection with one serotype gives lifelong immunity to that type, but only temporary protection against the others, meaning a person can get dengue more than once.
Symptoms and clinical presentation.
After an incubation period of 4 to 10 days, symptoms begin suddenly. Typical dengue fever causes high fever, severe headache, pain behind the eyes, muscle and joint pain, rash, and nausea or vomiting. Because of the intense pain, dengue is often called the breakbone fever. Most infections are mild, but in some cases, the illness progresses to severe dengue, also known as dengue hemorrhagic fever or dengue shock syndrome. Warning signs include persistent vomiting, bleeding gums, severe abdominal pain, or difficulty breathing. These symptoms require immediate medical attention, as severe dengue can be life-threatening.
Diagnosis and treatment.
Diagnosing dengue involves clinical evaluation supported by laboratory tests such as NS1 antigen detection, RT-PCR, or IgM, IgG serology. There is no specific antiviral treatment for dengue. Care focuses on relieving symptoms and preventing dehydration. Patients should drink plenty of fluids and avoid medications like aspirin or ibuprofen, which can increase bleeding risk. Severe cases may require hospitalization for fluid replacement and monitoring. Early detection and appropriate medical care can reduce the fatality rate to below 1%.
Prevention and control.
Prevention relies on controlling mosquito populations and protecting against bites. Simple measures save lives. Eliminate standing water in containers around homes. Use mosquito repellents and window screens. Wear long sleeves and use bed nets, especially during the day. Vaccination offers new hope. 2 vaccines, Dengvaxia and Qdenga, are approved in some countries, targeting individuals with prior dengue infection or in high-risk areas. However, vector control remains the most effective tool to stop transmission.
Global trends and public health response.
According to WHO, the number of dengue cases has increased 8-fold over the past 2 decades. Countries in Southeast Asia, Latin America, and the Western Pacific report the highest burdens, but recent local transmission in Europe and the United States shows the virus is expanding its reach. Public health strategies focus on early warning systems, community engagement, and integrated vector management. Digital surveillance tools and AI-based early alerts, such as Epi-Eye, are now helping track outbreaks in real time.
Conclusion. A call to action.
Dengue fever is preventable, and every action counts. By improving surveillance, boosting awareness, and empowering communities to reduce mosquito breeding, we can save thousands of lives each year. Together, we can fight dengue, one mosquito at a time. Follow Epi-Eye for global outbreak updates and scientific insights, because knowledge is the best defense against disease.
Consult a doctor and do as advised. If advised hospital admission, do so immediately. If advised home-based care, take plenty of fluids, nutritious food, and paracetamol for fever and pain. Prevent mosquito breeding and protect against mosquito bites. There is no treatment for dengue.
Stay tuned. Stay informed with Epi-Eye.com.